Hi everyone, welcome to my YouTube channel. This is Rida. Today we are going to have a quick overview on the anatomy of clavicle bone. The diagram shows the right clavicle. Introduction to this bone. It is a long bone. It is a bone of upper limb which supports the shoulder and transmits the weight of the upper limb to the sternum. It has two ends and one shaft. This bone is also called as collarbone or beauty bone. Peculiarities. It is the only long bone which lies horizontally. It is subcutaneous throughout and it is the first bone to start ossification, which has two primary centers of ossification, and it is the only long bone that ossifies in membrane, and it is said to lack medullary cavity, but there are few exceptions to this case. It has a sternal end or medial end which is large and quadrangular, articulating with the clavicular notch of the manubrium sternum, making a joint called as sternoclavicular joint. It also has a facet for the articulation of first rib. The lateral or acromial end is flat above downwards and articulates with the acromion process of the scapula, making a joint called as acromioclavicular joint. The shaft is divided as medial 2/3 and lateral 1/3. Medial 2/3 is rounded. It has four surfaces: anterior surface which is convex forward, posterior surface is smooth, superior surface is rough medially, and inferior surface have costoclavicular ligament medially and subclavian groove laterally. The lateral 1/3 is flat above downwards, having two borders: anterior border concave forwards, posterior border convex backwards. Two surfaces: superior surface and inferior surface. Side determination of the clavicle. The lateral end of the clavicle is flat and medial end of the clavicle is quadrangular. The medial 2/3 of the shaft of the clavicle is convex forwards and lateral 1/3 of the shaft of the clavicle is concave forwards. The inferior surface of clavicle have a longitudinal subclavian groove in its middle 1/3. Sex determination of the clavicle. The female clavicle is shorter, thinner, smoother, lighter and less curved when compared to a male clavicle. The lateral end of the female clavicle lies a little below to the medial end of the clavicle, whereas the lateral end of the male clavicle is either at the same level or slightly higher than the medial end. The joints formed by the clavicle bone are costoclavicular joint, which is formed by the articulation of first rib with the clavicle, and the sternoclavicular joint, which is formed by the articulation of the manubrium sternum with the clavicle, and acromioclavicular joint, which is formed by the articulation of acromion process of scapula with the clavicle. The clavicle gives attachment to various ligaments and muscles, and the nutrient foramina of the clavicle lies lateral to the longitudinal subclavian groove. So that was a quick and brief overview of the clavicle bone, and for more such content, subscribe to my YouTube channel.